Hi, folks. It's Sam here with yet another rendition of Heroes of Autism. Here today with Dr. Rosanna, who's going to talk to us today about picky eating. And we're going to focus on the autism population and why is picky eating so hard for some of us to overcome in the autism special. Because I'm a personal recovering picky eater. It's a joke I just came up on the spot here. And we're going to learn a bit more about that. So, Dr. Roseanne, before we begin our main topic, can you tell the folks a bit about yourself?
Absolutely. So, like you said, I'm Dr. Roseanne Lesack. I am a licensed psychologist. I'm also a board certified behavior analyst, so a BCBA at the doctoral level. And I've been working in the feeding community for almost 10 years now. And I initially did a lot of my training down at the Marcus Autism Center in Atlanta, Georgia, and then moved down to Florida and opened up and was the founding director of the Feeding Disorders Clinic at Nova Southeastern University. I've just gone into private practice, but have been in this whole feeding world for quite a while. And a huge part of the population really comes from those on the spectrum. So it really is a concern for many children, adults, parents who are struggling with kids who are, I would say, more than just picky eaters. So we can go into that a little bit more.
Why did you pick eating of all the topics to go into?
So that's a good question. It sort of fell into my lap. I had just finished all of my training and was trying to find a job, and there was a job open in the Feeding Disorders Clinic, and worked in a lot of different behavioral perspectives. I had done a lot of skill acquisition. I had done a lot of challenging behavior, and this was an area that I was really interested in using my skills in and seeing how I could take those behavioral strategies that I had learned throughout my training and see how I could use it in a new population. And then absolutely fell in love with the whole field. And really, that's where my passion has been and where my passion is now. So it sort of fell into my lap, but it really was meant to be, because I really do believe that this is such an important topic for so many people out there.
Thank you so much. So, what sort of challenges with picky eating do you see in the autism community?
So just like with any community, there's the mild to the severe. So when we're talking about mild concerns, maybe there are individuals who just don't like certain foods, sort of that typical picky eating, which is developmentally appropriate and usually not a concern. I've also seen children on the other spectrum where their picky eating was so severe that they actually had some significant medical concerns from it. So I've seen individuals who had scurvy, which means that they had zero vitamin C in their blood. So one individual I said literally didn't walk for 6 months because they thought he had an orthopedic concern, when really he just didn't have enough vitamin C in his blood, which causes you to not walk, and you really not be able to have the appropriate functioning. So his diet consisted of cream of wheat that was made with water and cheese puffs, and that's it. So I've really seen, like I said, the mild sort of typical picky eating to the pretty severe, and everything in between. So when you give, the typical bad diet of highly processed proteins, carbs and cheese and dairy, and really not eating many fruits and vegetables to balance out that diet. So it's very carb heavy, very processed protein heavy. Think of like chicken nuggets, hot dogs, those types of things, where there's enough variety to really balance out what's going on. And if you think about it, it also impacts the family, because then you have a child who isn't eating similarly to what the family is eating. And I'm sure maybe you can attest to that it's not pleasant to have parents at any given meal saying, just take a bite of this, just take a bite of that, just try this, just try this, just try. And that's not a great situation to be setting up for kids either.
Mm-hmm. Yeah, and I can definitely attest to being, I would say, like, I guess middle of the road, but for many many years and into my adulthood, all I would eat basically would be like chicken nuggets and ice cream and candy and some cereal and a couple other similar things, but there was not much variety. Like fruits and veggies, like it was really hard for me to do the texture. Like lettuce tasted like wet paper in my mouth. So I'm like, why am you making me eat wet paper? For many kids on the spectrum, it from my professional and personal experience, it's all about the texture rather than or in the taste. Like, and I think the other huge mystery for a lot of parents is it's about also trusting that that food will taste the same every time, and that we have control over the flavor. And the huge thing I think I had to learn is I do have control over my food and how it tastes. Like that, I can pour things that make it taste better, and then trick my taste buds into enjoying fruits and veggies. And um, it's definitely a huge challenge for me. But the key is making the food taste good, and then not only that, being consistent with how the food tastes. Because once there's any variation, like autistic people tend to see, in my experience, seem to pick up on that, and then they're like, "Oh, not going to try it anymore."
Right. So I think you talk about that rigidity, right? That you want to know, and that's the nice thing about processed food. Chicken nuggets always taste the same, right? If you buy the same brand, there's no variation. It always tastes same, right? McDonald's chicken nuggets always taste like McDonald's chicken nuggets. Chick-fil-A sandwiches taste like Chick-fil-A sandwiches. Domino's pizza always tastes like Domino's pizza. So that's sort of that rigidity that comes into play. And you're right that just because you have one apple, the next apple that you eat may taste a little bit different. And I think you're right that picking up on those slight variations is sort of what throws people in the autism community off, because there isn't that consistency and the knowledge that it's all going to really be the same. So that's the hard part, and then some flexibility. What I always talk to parents and to kids about is the good news is that just like you can learn to ride a bike and you can learn to read, you can learn to run, you can learn to swim, you can also learn to new flavors, but you have to actually work at it, and you actually have to go through that process of learning those new flavors. So that's the good news of it, but it's a little bit difficult.
Mm-hmm. Yeah, one huge challenge. My parents tried to bribe me that with like ice cream, if I just try this food rather than working with, oh, this is a new flavor for Sam, like, and not dealing, because it's more of like an emotional issue rather than something physical in the body. And how do you address the child's emotional attachment to certain foods and help them gain that trust with the new food?
Right. So I think the emotional piece of it, right? So there comes, and you might be able to explain more, there's a little bit of a fear of this new food, right? It's going to be gross. It's going to be disgusting. I know that chickens are delicious. I'm just going to stick with those. I know that ice cream is really good. I'm going to stick with that. And that a little bit of fear that comes into play when we're talking about these new foods. So what I generally try to encourage is, first of all, I don't love the term bribing, right? But the concept of you have to try a little bit of everything. What does a little bit mean? And for different individuals, that means a completely different thing. So for some people, what I'll start with is really taking the size of a grain of rice, right? Say you're trying to start with carrots. Pick one food, let the child have some choice, right? Do you want to try carrots? Do you want to try broccoli? Do you want to try pineapple? Whatever is new, and whatever, allowing the individual to have some choice in that part of it. And then having it be so small, right? The concept of having like a ginormous plate of peas in front of you, right? To get that ice cream, that is really, it's not going to happen, right? It's just so overwhelming to see this humongous serving of something that is completely vile. Is not going to happen. So if you start off with what I say is one rice size amount, right? That is that emotional piece. Your anxiety goes down a little bit, right? Your physiological response goes down a little bit. And even if you can get that one rice size to just touch your lips once, that's success, right? Really slowly introducing something so that it is not creating this really big reaction or response. So I like to start low and slow. Let the child or the individual pick Doesn't matter to me which one it is. Give them a between sizes. Some individuals may want to start with a larger size, but go down literally as small as 1 grain of rice. And if step 1 is just touching it to your lip for 1 second, that's success. Then you can slowly build, because that emotional response will decrease. I sort of think of it like if you have a phobia of dogs, or if you have a phobia of flying. You don't just like get on an airplane or bring a dog right into your house. You have to slowly habituate, slowly get accustomed to the new requirement, following the child's lead as to what that's going to be, but still having a reasonable requirement out there. Yes, if you want your ice cream, awesome. Just touch it to your lip for a second and that's it. So starting with a more reasonable request is really helpful for individuals who are, like you said, having that emotional response to the new food.
Yeah, and again, folks, it's like giving your child that choice is so important because it gives them a sense of control, and that's very big in the autism community. It helps lower our anxiety tremendously for me, and that's like why I was able to make a breakthrough. I did small portions of new foods, and but seeing a mountain of peas, it can be anxiety inducing. It's like, this is new. It looks disgusting. I really wanted ice cream, but just all that fear of me being so vile can be very overwhelming for any picky eater. Why do you think we have such an emotional attachment to our food? Why can't we just like, oh, I need this, plop it in my mouth, or just like, oh, I need to be able to see, turn on the light. Like turning on a light is like nothing. But,
right. Well, because we have so many sensory inputs that go along with it, right? It's not just, a light is a little bit more of a benign object out there, but we smell the food, we taste the food, we feel the food in our mouth. It has a lot of senses that are going, we see the food, it has a lot of senses that go into it. And, right, and people, there are individuals who respond really negatively to really bright lights, right? So depending on each individual, they can have a pretty specific reaction to different items. But food, number one, food is something that we need on a regular basis, right? We have to eat throughout the day to give our bodies enough energy to make it through our day. And right, having it inside our mouth where we're feeling it and tasting it and hearing it and smelling it, it's a very intimate experience to be eating food on such a regular basis. So for me, I think that's probably why, because there's so many of our senses that play into what it means to eat something.
Yeah, that's definitely a great response, and it is like a huge experience. And for parents out there that wonder why this is such an experience for their autistic children, especially, is because our sensory input is not subconscious like it is for a neurotypical brain. It's all conscious. So like you're saying, the feeling of the food, the texture and stuff, like we spend a long time observing that and experiencing that. It's not just like you smell a whiff of peas for half a second. No, that smell is like with us for the entire meal, or long after the meal. Like we're still thinking about that smell or the way it looked or how it felt. And that's why I agree, like your whole thing about putting just a grain of rice to the lips and then giving them the ice cream. Okay, like you want them to eat more. Well, and then once you establish that trust with just putting it to the lips, you move on to the next step, 2 grains of rice, or whatever portion that you and the child agreed upon, and you make it bigger and bigger over time. And just understand it's a process.
Right, and some parents, the way I talk about it, some parents, for example, if the child doesn't eat ice cream, a parent will say, what child doesn't eat ice cream? How is it possible that an individual doesn't love ice cream? They just haven't tried it enough. If I could just, shove it in there, then they'll like it. And the way I speak to parents about it is I give them the scenario. What if I wanted you to eat crickets? There's a lot of people in the world who eat crickets, there's a lot of people in the world who eat ants. Most of the parents that I work with don't eat crickets or ants on a normal basis. But I'll say, what if I put a whole plate of crickets in front of you? What would be your response, right? Most parents say, oh, that's disgusting. Well, now you can understand a little bit what it means for your child to have that kind of response to a plate of peas. It's the same concept, right? And if I wanted to get you to eat crickets and I came up to your mouth with a whole spoonful of crickets, how would you react?
Mm-hmm.
Would you eat a spoonful of crickets for a bowl of ice cream? No.
No.
Would you eat would you eat a spoonful of crickets so that you can go to the park afterwards or get a new toy train? No, right? Because that's the parallel that I think really helps parents understand what our children are going through, right? So then I said, well, what if I needed you to get to eat crickets? That it was really a life or death situation for you to eat crickets. Come out with maybe like a teeny bit of an antenna. Could you do that? The parent says, if I needed to, yes. Okay, so that's where we start with your children, right? Parents say, oh, but you're starting so small, they don't even get the taste of it, because it's oftentimes not necessarily about the taste either. It's sort of that mental perception of what it is. It is something new, it is something I don't know. And they're right that once children get to, that fear response decreases and they try these new foods, kids like ice cream. Kids like a bunch of foods because food is delicious.
Mm-hmm.
I can get over that fear response. So that sort of parallel of using the crickets really helps parents understand some of the visceral reactions and the physiological reactions that their children are going through. Like, oh, come on, stop gagging. It's not that bad. Well, if you had a cricket antenna in your mouth, would you be gagging? You might be, right? And that's a nice parallel to really give them an understanding of what individuals might be going through.
Excellent. And I think you made an excellent point about like someone like shoving a spoon in your child's mouth, and just think about that. If someone like 3 times your size is coming at you, like that also can create such a negative attachment to that food. That every time they see that food, now they're just gonna remember that moment, either consciously or subconsciously, of you shoving a spoon aggressively into your child's mouth, or that negative comment like "Stop gagging, it's not that bad." Which leads to my next question: how should parents conduct themselves when trying to get their kid to eat? Should they be aggressive? Should they be patient? Like what should their demeanor be?
So a few things. One is I think that there are the individuals whose guidance through parents can be helpful and can help their child move in the right direction. I do want to put a disclaimer that for some individuals, there may need to be more intervention out there, right? Like I said, when I'm working with a child who has scurvy, that individual needs a higher level of help and support from a professional in the field. But if we're talking about that mild, moderate concern going on, I think two things and this is sort of a general parenting tip: autism, non-autism, feeding, non-feeding. If your child is engaging in, intense behaviors, try to have a neutral response, right? A lot of positive attention for the behaviors you want to see, and then a neutral response for the behaviors you don't want to see. You don't want to be yelling at a meal. You don't want to be screaming at a meal. You don't want to be guilting your child into it, right? It should be very positive to neutral. So that's the demeanor that I really suggest parents approach this with. And again, as we spoke about, having a lot of choice when possible, right? We do carrots, we can do broccoli, we can do pineapple. But again, if you don't choose, I'm going to have to choose. I really prefer if you choose. We can work on a food that you used to eat and you stopped eating, right? But I do understand where a child will say, well, I don't want to work on anything. Okay, well then if you don't want to choose, that's okay. But then I'm going to have to choose, right? And so helping, again, coming up with the easiest option to move that child forward.
Yeah, and then I think the other huge part for parents out there is, I agree, like being neutral is the best thing when you see troubling behaviors, but also not giving them the reward if they do not do what you're trying to get them to do is the other huge part. Not giving them that bowl of ice cream or candy or whatever it is you're trying to entice the child's interest with. Because that's teaching them that's not teaching them to like the food. It's teaching them that this bad behavior gets me what I want. Is not
Right,
a good thing.
right. So that reinforcing inappropriate behavior you want to avoid. But I also understand it, right? When I think of a parent's first role as a parent, right? The hospital or wherever, you hold your child for the first time. And what your main responsibility to that child? To feed that individual, right? That's all you have to do. Sure, you have to change diapers, sure, you have to hold them, right? But to make sure your child is healthy and grows, you have to feed your child. That's your first role as a parent. So that's a very interesting interplay. You know, say when your child is 4, 5, 6, 7, 13, pick an age, and all of a sudden your child is not going to eat what you provide for dinner. I understand that it's really difficult for parents to then say, all right, so then don't eat. That's a really hard job when your first job parent was to feed your child, and now you're not feeding your child. It's a really emotional piece for parents as well, to really just say, okay, then don't eat. And as I'm sure you know, there's a lot of individuals in the autism community that really won't eat, right? Your typical picky eater, after a day, after 2 days, fine, I'll take a bite of it, it's fine. But I've seen parents and children where the parents really do not give their child food, and the child does not eat for days and loses a precipitous amount of weight. So again, I think it's really important to identify what level of concern are you at, and what level of partnership can you get from your child to be a part of that if you're working on it at home. And again, if you're in the more moderate to severe category, you may just need some extra support and professional guidance onto what those next steps would be.
Definitely. And I think the other key is not to, like you said, don't feed your child, like having those choices, like whether it be the reward should be for the preferred behavior, but if they choose not to go for the reward, have like the alternative, like cheese puff, like something for them to eat so they're not starving. But just know that like whatever the reward is, it has to be big, like big enough that like they want it. You don't have to starve your child, but you have to hold the reward and attach it to the behavior that you want to see. I think that's the key. Is we're not asking you to starve your child. Because like you said, and I've seen that in my professional experience too, that the child just won't eat. No matter, even though you can tell they're obviously hungry, they just won't. And that's the key, is just having variety. And I know that may for some parents be frustrating. What do you mean I have to cook like 3 different meals for dinner? I'm like maybe that case, but like what's more important here is developing that trust between your child and their food, and doing it in a respectful way rather than trying to jam a spoon or fork into their mouth and traumatizing them when it comes to trying to get them to eat those peas. And it goes back to what you were saying earlier, that just that grain of rice to the lips, just starting that simply, and then rewarding that behavior, and then making a steady progression to them eating, a cup of rice, in a few months. It's well worth it, because that's how they learn to eat healthy over a lifetime, and that's how they don't end up like adults like me who had just cans of chicken soup and chicken, every kind of chicken you can think of in my fridge and nothing else until recently. And that's the huge thing for parents. I think it's trust. It's more about feeding your child trust than feed them peas at this point.
Right. And I think exactly what you said. It's a long game, not a short game, right? And when you pick a food, try to stick with that one food, because again, learning how to like peas does not mean you automatically like carrots. Right. You have to rework on each food individually. But what I'll see parents do is jump around. Oh, they don't like peas, let's try carrots. Oh, they don't like carrots, let's try green beans. Oh, they don't like green beans. Well, they're never going to get used to that one food. So stick with that one food until it really has become a mastered food. And the other piece I talk to parents and children about is that you don't have to love everything. Everything doesn't have to taste absolutely delicious. If that were the case, I would only eat ice cream all day, every day, because I also love ice cream. But there's some foods that you really love. There's some foods that you can tolerate, meaning like, okay, I don't love it, but I'll eat it because that's what maybe my husband made for dinner and I didn't have to cook tonight. So great, I'll have it for dinner tonight. And then there's foods that really it's okay if your child does not like. And I generally, what parents and children are working off of is I love it or I hate it. And there's nothing in between.
Mm-hmm.
right? So getting some in-between foods that, like, sure, I don't love peas, but I'll have a, I'll have a small serving of them because I'm also eating it with my favorite chicken dish, right? So you can go back and forth between chicken, some peas, chicken, some peas. So it's not just eating all that chicken and leaving those peas, which, like, I don't love at the end, because then it's a very low chance that you're going to actually eat them all. So being able to sort of go back and forth between a really preferred food and a food that you can tolerate is a really important skill also. That all foods aren't just in the love category. There's some foods that, like, they're fine, I'll eat them, but it's never going to be the same as my favorite ice cream. And that's okay, as long as they can tolerate those flavors mixed in with the higher preferred flavors as well.
And that's how I go for a lot of my picky eating. What you're doing by, as you said, like a piece of chicken, then a pea, chicken meat. I am rewarding myself for eating that pea, and creating that positive relationship with the new food myself. And that it doesn't have to be ice cream, folks, or something sugary. It could be chicken, or whatever meat or other kinds of food your child likes. So, like, for every bite of the food that they love, they take a food of the food they tolerate. That's a very simple way of building that tolerance. Even if it's like the smallest bite, like just like half a centimeter of a carrot, or, like, it's like that much. Like, when they take a bite, like, that's how you start building that positive relationship. And for the individual to build that relationship themselves, like, get them involved in learning new foods. It could be helping you cook. Is another way. Like, my wife would help, like push me to help her cook, and, like, get used to the sensation of feeling the food in my hands, chopping it up, and because it allowed me to see I have control of this food. I can manipulate it however I want, and cut it to the small slices that I'm willing to tolerate. Is another thing. Again, I keep going back to it's all about trust and control. And then when your child feels both, they're going to be more willing. Um, and you can even just start there, not even putting it to the lips. Just help me cook the food. You don't have to eat it, but just having them around the new food, so they get used to the smell and the sight and the sensory input, can be another great step. That helped me, and I think could help your children out there.
Absolutely. I always encourage parents to take their kids to the grocery store, have them look at the different foods, have them pick out what they think is interesting, have them be in the kitchen preparing food. Again, getting used to all those different sensory pieces that go into it. It's not just about eating it. It's about the smell of it. It's about getting used to the sight of it, right? Does it look squishy? Does it look juicy, right? Exactly. I think that's really helpful to begin that process. And then again, after they've mastered that process, thinking about what that next step can be. That's going to be the easiest, most reasonable expectation for them.
Yeah. How do you feel about hiding new foods in your child's food? Because I know there's, like, these books out there that, like, teach you how to, like, make veggies into, like, your kids' meals, so they're not even aware. Do you think that's a good idea to hide it, or is that, like, deceptive? Because, like, as soon as the kid finds out, they're like, "You lied."
Well, I guess depends on what the parent's goal is. Is the goal to get in enough appropriate nutrition for your child that you're hiding it in? Or is it to say that, oh, my child eats carrots? If the goal is to get some nutrition in, you can do it that way, or you can do it through a multivitamin. But there is very little research out there that's going to support that, putting carrots into your brownies is going to get them to one day eat carrots. So if your goal is to get them to actually eat carrots, or to eat broccoli, or eat these different foods, that doesn't do anything. That's sort of like just sprinkling, vitamins into everything to make sure they're, nutritionally complete, which is an important job, which is an important task. So if that's the way you're doing it, okay, but that is not going to lead to your child actually eating those foods in their context, because it's not the flavor of carrots, it's not the smell of carrots, it's not the sight of carrots, which we just about are some important pieces to get used to if you're going to actually eat carrots. Mm-hmm. So that's what I would say, that if you're doing it, as a nutritional supplement to ensure your child's getting enough minerals and nutrients and vitamins, Okay, but then what's the plan to move it out of brownies and into an actual meal?
Right. Yeah. And yeah, I would say that that's certainly true. Like I started off by soaking my veggies in like barbecue sauce, but then I'm not actually tasting the veggies. I'm just tasting barbecue sauce. And so like that's a huge thing for parents. You have to figure out what you actually want from your child. Like you said, I think like if you want them to get the nutritional, then go ahead soak it in barbecue sauce. But if you want them to actually like the food on its own, it has to be this process of building trust with that new food. Uh, like that was my whole thing with pizza because I thought pizza was too spicy. Even cheese pizza too spicy for me. Like yeah, like and everyone's reaction is like you said earlier. But Sam, like every kid likes pizza. How can you not like pizza? I'm like, and then it came to college where I saw everyone eating pizza, and I wanted to make friends. So my reward was friendship, which got me to eat new foods. And there are many creative ways to get your child involved in eating new foods. Socializing is a big thing in the autism community, like, and it's finding what your child really wants to do at that time, and then integrating it and associating that food with something positive. I think that's the hugest step. Um,
So I'll jump in. One thing that when we think about food, there's generally three reasons why we eat.
right.
Right. So the first one is for nutrition. If we don't have enough fuel and the right kind of fuel, we're not going to be healthy and we're not going to grow in development. The second one you just talked about was a social component, right? Every holiday, every birthday, every time we go out with friends, it can be a a big part of the eating has a social component, right? In the lunchroom, kids, at the dinner table for kids. So if they can't be part of that social component, like you were talking about, then there's also another sort of gap in what's going on. Or if your entire dinner time with your family is spent with your parents saying, come on, just take a bite to try, a bite to try, that's not fun. So that social piece is a really important part that goes on during our eating times, right? If we eat about 5 times a day, right, 3 meals, 2 snacks, each them, let's say about a half hour each time, that's 2.5 hours of socialization that a child could be missing out on because they can't stand the smell of what's going on around them. So that socialization piece is really important to think about how to integrate the social pieces into your meals and what that looks like. And then the third reason we eat is for emotional input, because I like it, right? I don't eat ice cream because it is nutritionally complete. I eat ice cream maybe during certain social interactions, but I'm not social at 10 o'clock at night when I get it out of my freezer. I'm doing it because I like it, and there's an emotional input that I get from it. So it's important to think about those 3 different pieces of why we eat. Also, when you're thinking about how to get your child moving in the right direction as well.
Yeah, and the other great thing about socializing while eating is your child's not paying attention to the food as much. Like my son, for example, didn't like a certain food, but we kept putting it on his plate like little bits, and he got distracted by what was we were watching a Disney movie like Cars, and he not paying attention when and just put the food in his mouth, and he started trying. It's also a great way to distract your child, like, and then when you catch your child doing it, you how you react is, oh my god, you ate a carrot. Like, and that's the other huge thing is you as the parent have to have a positive reaction when they actually they do eat the food that you want. Because the big thing about autistic children is we're not good at reading facial expressions. So your expression needs to be big. It can't just be good job. Mm. No, it has to be great, like cartoony. And that social aspect is huge, I think, for a parent and building that trust. You have to make it fun. Like when your child was a baby, you did the whole airplane thing, and it worked. Keep make it a bit more age appropriate, but keep making it a game rather than a chore. And the social aspect is how you make eating fun, and rather than oh I have to do this. Um, and what was the third aspect you said again? I'm sorry.
That emotional piece that we eat because we like it, right? If I'm full, there's always room for ice cream because I just really enjoy ice cream.
Right. And that's the huge thing is you want to in order to get to that third component, you have to complete the first two components, which is, trust and the social aspect. Like you have to create these incentives, and it doesn't require a lot of work. It just requires you talking to your child and being goofy, which all parents know how to do with small children or older children. Like find that aspect, or even if it is putting on their favorite TV program and putting food in front of them, they won't be paying attention. And again, it's associating that food with something positive. When the TV goes on, it's time to eat, and it's a good way to have the brain associate positivity with foods. Because the huge thing is that we're visual learners, and we process our emotions visually, like to what most of the time what is visually pleasing. And that's part of and then you want to associate that with the food. That when I see that food, like subconsciously, that autistic child will be like, that this is something good, because last time I ate this, I was laughing. Is I think another key component. Like I can't go on about the social aspect.
Yeah, it's a really important part that I think a lot of families miss.
Mm-hmm. And the other key component, I think, is also the weird. There's a lot of health components that go into autistic, like a lot of coexisting conditions that go along with autistic people and foods, like their body's not able to process certain foods, and that can be a real challenge. How do you get them to get the nutrition they need, but they know that their body is going to react poorly to certain kinds of food?
What do you mean by react horribly to certain kinds of food? Give me a little more about that.
Like for example, like there are a lot of children on the spectrum that have poor gut health. That I had one client who she ate too much food. She would just throw it up. Not that she didn't like it. She had this weird gag reflex or like stomach issue there was too much in there that her body would just immediately reject all the food, and then she loses all that nutrition. For example.
Right. So it's really important also to think about the underlying medical concerns that there might be. So children with autism are just as likely to have a food allergy as anybody else out there, to be allergic to nuts, to be allergic to be celiac. So I think knowing, and I've had a few of those patients where they're not able to express in the same way how their body is feeling as other individuals might, right? So my daughter, who's neurotypical, has a nut allergy, and she's super verbal, super, expressive. But when she was 4 years old and she would eat nuts, she would just say, "Oh, this tastes disgusting. I don't like it." Right? Me being the food therapist, I said, "Well, nuts are really healthy. You have to eat nuts. I'm going to get you to eat nuts." Well, it turns out she was allergic to nuts, but her response wasn't, "Ooh, my tongue feels a little bit tingly. My lips feel a little bit weird. My throat is getting really scratchy." Her response was just, "Ew, that's disgusting." And she has a great vocabulary, and she has no problem expressing her emotions, right? So I always think about our children on the spectrum who are not really good at expressing sort of the feelings that are going on. So it's really important to know if there's a real medical allergy out there. Go to your pediatrician, go to a GI doctor. There's also some pretty significant GI concerns. We know children on the spectrum have a higher rate of constipation, right? So if someone's constipated and really impacted, you're not gonna wanna eat. It's uncomfortable because you're really full and it's just pushing up against everything, and you're right. So number one is to make sure that there's no underlying medical concern. I will also say that there's a lot of information out there which may not be completely, any fad diets out there, right? Oh, just try gluten-free. Well, if you take a kid whose main diet, and I've seen this before, is mac and cheese, pizza, chicken nuggets, and you put them on a gluten-free, casein-free diet without any real medical reason to do that, now your child's eating nothing. And I saw a child who went from having a fine diet, it wasn't great, to literally going to veggie straws and apple juice because parent put him on a gluten-free, casein-free diet because she wanted to cure the autism symptoms. So it's really important to make sure you're getting really good medical advice of, is my child not eating certain foods because, right, they shouldn't eat certain foods because they have a real authentic allergy, right, that has been, diagnosed by a medical doctor. Red flags, when people come to me and say, well, I saw a medical doctor and he said that X, Y, and Z. So 2 red flags always come up for me. One is that doctor also selling in his or her doctor's office before you leave, right? Nutrients, supplements, all those kinds of things. When I go to my doctor, if they prescribe me cream or medication or antibiotics, I don't buy it in my doctor's office. I have to go to the pharmacy to actually get that item. So the question is always, are they selling what they're trying to prescribe you in their office? That's always a red flag for me, because then they're trying to sell you something that they're, getting something from. And the other red flag is this a test that your insurance is not paying for? Right? Most legitimate allergy tests, any insurance will basically pay for it. So if it's a test that your insurance isn't paying for, that's a second red flag for me, right? Would they pay for one allergy test but not another? Then there may not be enough support for that allergy test. So for parents to think about, any other underlying medical concerns, sure, there may be something there, right? So make sure that you're going to a trusted medical professional who is going to be covered by insurance if you have insurance. And those are the ones that you want to make sure that you're following before trying to get your child to eat new food, because you want to make sure it is a safe food for your child to eat. And again, any allergic reactions, your child may not be able to adequately communicate what experience is going on inside his or her body.
Yeah, and that can be a challenge. Is there something wrong, or is this child acting up, or they, do they actually have a stomach ache? Are they just faking a stomach ache, just so they don't eat? Because they've learned that when I have a stomach ache, I don't have to eat anymore. That it can be really tricky. And what I often tell parents is, like, look at before the child. Learn to read your child's body language. Like, your child, like, when they're enjoying food, like, what is their body language like? Is it, bouncing about happily in their seat, or is there a smile? Are they obviously enjoying the food? Or when they are sick, like, really watch. I even tell parents, tape your child eating if you're not sure when they are enjoying and when not, and compare. And, like, it's like in sports, that go back to the camera and watch the changes in their features, so when this is real or this is fake. And then, but even when your child is fake, I think the other huge part is, be sensitive to the fact that this is hard for them. Don't just scold them for faking. And that shows you that you still need to address the emotional component of food. Okay, we need to go back to square one, putting that rice to the lips, or whatever step was before, and make sure that is mastered. Because we want to get your child to the point where they enjoy the food, and learn to really observe your child and their feelings is how you get there and know what you have to do next. Before I let you go, is there any other advice or resources that you think would be really helpful for parents to help overcome their challenges with their picky eaters?
I think the most important piece is to be patient. As you mentioned, this is really hard for children. They're not just doing it because, for the sake of doing it, right? As we know, it's really difficult for our autism kids to get used to new things in general, and especially new flavors that are inside their mouth. So be patient, be patient, be patient. Think of what can be the easiest first step for your child. I was just working with a family and they said, well, he took a really teeny bite, but I didn't think that was good enough. So I made him take a big bite, and then it was a really big fight. And I said, no, the teeny bite is success, right? So it may be helpful to change your definition of what success is. Try to have it be the easiest first step possible, even if that first step is ridiculously easy, because you want it to be a successful, whole trajectory, not just the end goal. It's really, you want to make that process as easy as possible. So patience, start really low and really slow. And if you continue to struggle, ask and get some professional advice. There's not many people who specialize in feeding specifically. There's a lot of people who do behavior and, oh, I do a little bit of feeding here, a little bit of feeding there. If that isn't working, try to find someone who really is a feeding specialist and who works with this exclusively, because there are a number of different strategies that absolutely can help your child get past this.
All right. Thank you, Dr. Roseanne, so much for all the wonderful advice in this conversation. How can folks get in touch with you if they want to book a session or learn more of what you do?
Great. So I am on Instagram at Dr. Roseanne Lesack, so definitely follow me there. I also have a website which is lesackparenting.com. That's Lesack parenting.com. So you can find me there also. And all of my contact information is listed on my website. Thank you so much for having me, Sam. This was really a wonderful experience, and I hope this is helpful to some of your families and community.
All right, thank you so much. All right, folks, this has been another episode of Heroes of Autism. This is Samuel Huber from Huber Family Adventures on Instagram, Samuel Huber on YouTube, Samuel Huber on Facebook, www.samuelhuber.net on that's my website. But the big places to get me are here on YouTube. Please subscribe below or on Instagram. And I hope to have chats with you. And I hope this video was helpful. All right, folks, this has been another one. Nice talking.